you to the hospital?
My wrist.
How did that happen?
I was riding the Ferris wheel and this huge seagull flew right at me.
How horrifying.
I swung my arm at the bird, but I hit the Ferris wheel.
She's making it all up?
No, her wrist really does hurt.
I'm not lying.
Of course you are. You have no idea what happened. You have no memory. Korsakoff syndrome. Her brain is damaged by excessive drinking or insufficient diet, pretty obviously the latter. She has no new memories, no new ideas, can't even process that idea. So her brain fills the gaps as best it can using visual clues. The horse on your shirt led her to the riding accident, and the surf scene on your clipboard.
One vitamin deficiency, one lifestyle, and one condition: the Wernicke encephalopathy. Wernicke encephalopathy is a neurological disease due to deficiency or lack of vitamin B1 or thiamine. It is characterized by a triad of symptoms: confusion, ataxia, which is the inability to maintain and coordinate balance, especially while walking, eye abnormalities. The commonest cause of this deficiency is chronic excessive consumption of alcohol. Wernicke encephalopathy, also known as Wernicke disease or Wernicke Korsakoff syndrome in its extreme, is a neurological disease characterized by intense brain swelling. A reason it is called wet brain syndrome. Welcome to Body Hacks 101 with Dr. Nelson, where I show you how to optimize the natural powers of your body in order to boost your health. In today's video, I'll be showing you the role of vitamin B1 in the body, the cause, the symptoms, treatment and prevention of Wernicke encephalopathy or Wernicke Korsakoff syndrome in the extreme. Vitamin B1 or thiamine is an important spark in the breakdown of glucose, which is the primary source of energy to the brain. Deficiency of vitamin B1 or thiamine affects the functioning of the brain, especially the hypothalamus, which is responsible for temperature, appetite, emotion, and growth regulation. At this point, it is worth noting that deficiency of thiamine or vitamin B1 is mostly felt by two systems in the body: the nervous system and the cardiovascular system. What is the cause of Wernicke encephalopathy? There are several causes of Wernicke encephalopathy. However, the commonest cause, as stated earlier, is chronic excessive consumption of alcohol. Chronic alcoholics often have poor diet, deficient in vitamin B1 or thiamine. Furthermore, alcohol blocks the intestinal absorption of thiamine and prevents its utilization in the cells of the brain. Also, alcohol increases the urinary loss of thiamine as well as blocks its storage in the liver. As stated earlier, the Wernicke encephalopathy comprises a triad of symptoms. However, most patients do not present with all these symptoms, but will most often than not present with confusion and disorientation. This could lead to lack of attention, lethargy, aggressiveness, and combativeness. In the most extreme of cases, the patient could progress to coma or even death. Ataxia. This is the inability to maintain and coordinate balance, especially while walking, usually with the legs wide apart. These patients usually require support by hand. Regarding eye abnormalities, patients with Wernicke encephalopathy usually have difficulty in controlling their eye movements. They may present with symptoms like double vision, rapid involuntary up and down, side-by-side eye movements, a condition called nystagmus, weakness of the eye muscles, or what we call ophthalmoplegia, or even drooping of the upper eyelid, a condition called ptosis. As stated earlier, 10 to 20% of patients with Wernicke encephalopathy progress to coma or even death if not attended early enough. 80% of these patients progress to the extreme end of this condition called the Korsakoff syndrome. The symptoms of Korsakoff syndrome gradually develops as the symptoms of Wernicke encephalopathy disappears. This is the point of mistake in many healthcare settings, where chronic alcoholics admitted in emergency will be mistaken to be drunk, allowed to recover, only for them to progress to the Korsakoff end of the syndrome. Korsakoff psychosis is marked by inability to make new memories, a condition called antegrade amnesia. In this condition, the patient has difficulty in recalling the most recent conversation or learning new ideas. For example, you have to keep reminding them of your name or keep showing them the route to the same route. In fact, every day appears like a new day. They could also have difficulty in recalling past events, a condition called retrograde amnesia. They have difficulty putting the right word into context or even understanding simple ideas. They have memory gaps, which they attempt to fill by making up fictitious stories with available clues they can lay their hands on. This is called confabulation. Now, treatment. When you notice a chronic alcoholic exhibiting any of the above symptoms, the person should be rushed to a healthcare setting as an emergency, where the person is quickly assessed and commenced on intravenous vitamin B1 or thiamine with oral supplementation. This condition is managed by a multidisciplinary team consisting of a psychiatrist, neurologist, cardiologist, gastroenterologist, nutritionist, physiotherapist, and alcohol service. The goal of the treatment is to reverse the dangerous effects of vitamin B1 deficiency, prevent progression to the dangerous Korsakoff end, while helping the individual quit alcohol. Regarding prevention, avoid alcohol. I know this could be pretty difficult. However, if you must drink, drink in moderation. Avoid chronic binges. Eat a healthy, balanced diet rich in vitamin B1 or thiamine, such as legumes, grains, pork, meat, fish, and egg, while supplementing with oral vitamin B1. Finally, Wernicke encephalopathy is one condition that is well known by healthcare professionals and the public. This is because this condition is highly reversible, especially when early treatment and rehabilitation are done following diagnosis. However, its Korsakoff end is almost irreversible and will most likely require a lifelong care.